Good afternoon. My name is Angela Tumbenting Echiverri, and I'm a family medicine physician and newly a core faculty member of the Contra Costa Family Medicine Residency Program. In this new role, I serve as a strategic lead for inclusion, diversity, equity, and allyship, otherwise known as IDEA. It has been a long yet fulfilling road to get to this place, and 2018 has been a year of crucial conversations, key challenges, immense growth, strengthening of relationships and partnerships, both personally and professionally, and opportunities to create and imagine. My calling to leadership in the health equity arena is deeply personal. I am a first-generation queer woman of color physician, and I'm not supposed to be here, to be where I am today. Data shows that racial and ethnic minorities are underrepresented in the health professions, despite the fact that they represent the demographic majority in the state of California. Underrepresented minorities comprise a small proportion of students in higher education and in the health professions, and as providers, as faculty members, and as executive health leaders. My being at the table is a revolutionary act. I have been committed to developing and strengthening health career pathways because I know that they work. I know they work because I am a direct product of a pipeline program, a graduate of a high school program dedicated to students of color geared towards the sciences. I was a part of the first graduating class of the California Academy of Math and Sciences on the campus of Cal State Dominguez Hills. Our class was comprised of 100% proud to be nerds. Marlon Luna, Maya Spiritu, Cynthia Jones, Riza Ibrahim. We were all bussed in from low-performing schools and districts across LA County. We were applying to Ivy League institutions, donning college sweatshirts, stacking up on AP coursework, taking Calculus 2 and Physics on the evenings and weekends at Cal State and community college campuses, and starting and leading organizations committed to making their mark in the world around global health, the environment, and mentoring others. Our senior photos showcase captions stating our future career aspirations. I wrote General Surgeon, or Surgeon General, even though I had none in my family, or worse yet, had no idea what those titles meant. My father lost his job when I started college, and so I gave up on our collective dreams of an Ivy League education and lived at home to attend UCLA. I maxed out on all my financial aid to help the family, took a full course load, commuted 40 minutes each way to campus, and worked 30 hours weekly as a lab tech at a neurosurgery lab. I spent a lot of time in that lab. I wore latex gloves most days. I washed Pyrex funnels and beakers with industry-grade soap. I sterilized tools with the hum and steam of autoclaves. I sliced tissue. I prepped them onto glass slides, created chemical solutions and concoctions that stained the brain tissue a beautiful purple and pink hue. I worked in that lab for most of the 5 years of my undergrad career, and yet did not feel part of that lab community. I wasn't the one asking questions, generating hypotheses, testing them out, or publishing papers. I confronted this truth one day while wearing my starchy white coat, stained with dyes, reeking of a mixture of acetone, formaldehyde, and alcohol, and I can still smell that to this day. One of the lead investigators, Dr. Lee, stopped me in the hall one day and he asked what I was going to do after I graduated. And I shrugged and mumbled, I'm gonna be a doctor. He followed that naive assertion with a questioning, really? Huh, well, I don't think you're gonna get into med school. Those words felt with the same heaviness as when they were said by advisors who said my grades didn't cut it. From pre-med classmates who snickered at the dearth of activities in community service and in leadership, and from outreach representatives who pointed out that I had a lack of clinical shadowing experience. Those words unlocked my own inner demons, voices in my head about all the things that I was, and more so what I was not. It was wrapped around all the woes, the angst, the crisis of confidence, imposter syndrome, and all the inadequacy that plagued and paralyzed me. I felt the starchy white coat scratch away at the outer surface, leaving me vulnerable and exposed, and I stood frozen, paralyzed by the weight of his words. Tears started to stream down my eyes as desperately as I tried to fight them off. And he left me in the hallway in that state, not realizing that his words had eviscerated me. He walked away, likely feeling content with our conversation, having just given me sound career advice, thinking how he had mentored me in that moment, helped guide me to a new career path, and saved me from undue hardship, helping me to figure out early on that medicine was not an option. And yet we all know that that was so far from the truth. It took me a long time to recover from that, but I did. I did because I found a family, I found a community, and I found a home in pipeline programs, just as I had at my high school. This path towards wellness, towards healing and becoming again, came from a myriad of community health experiences. Like when I walked door to door in the city of Wilmington, when Dr. Granados asked about community members from immigrant households about their use of social services as part of a pipeline program focused on community-oriented primary care at Harbor UCLA. When I was setting up town hall meetings talking to older adults at local churches in Compton, talking about hypertension as a silent killer of Black communities as part of a project under Dr. Myers. And when I was teaching high school students from Watts about sickle cell disease at the Saturday Science Academy, a pipeline program led by Lorraine Gray at the Charles R. Drew University, a historically Black university and minority-serving institution. It was about affirming myself and my career aspiration as a provider rooted in the community. It was about using my voice and experiences to lift up others as I climb. It was about making sure that classrooms and cohorts of health professional schools looked as diverse as my high school graduating class. Because you can't be what you can't see. It was about ensuring that young people of color have access to the same opportunities, resources, networks, mentors, and a system that affirms their talents and smarts, supports them on the daily, and challenges them to pursue their own audacious and bold dreams. After a year of transformation through this fellowship, one of my early commitments was to ensure that Contra Costa Health Services, our residency program, and health systems overall acknowledge and affirm the importance of investing in local communities to draw talent, skills, and knowledge from within the local community into our health workforce, and to center that work with a focus on investing in young people. As a National Health Service Corps scholar, I had a 2-year service commitment that led me to West Contra Costa County. I was neither born nor raised in Richmond, but I am honored and privileged to work in that community. When I started working at the North Richmond Center for Health, I knew I wanted to work on growing health career pathways as a means of giving back and paying it forward, as well as dedicate my time and energy to the young people of the community of Richmond. I also knew early on that starting a pipeline program was not a part of this future vision. So I went about surveying the landscape of pipeline programs in that community, met with the Boys and Girls Club, with Girls Inc. and RISE. I met with key stakeholders and leaders in the community and in our health system after clinic, attended meetings at the school district and youth-based organizations, and most of all, I listened. Through this time of community building, I connected with an established program, Public Health Solutions, which had demonstrated proven success. It was led by 2 amazing women of Contra Costa County who had forged strong connections with the schools, and importantly, I got your back type of relationships with the students and their families. Delivered public health curriculum in the classroom, had critical ties to the organizations in the community, and developed a solid summer community health internship experience. I had one-on-one meetings with these fierce leaders, Shannon Ladner Beasley and Cedrita Claiborne, or Mrs. B and Mrs. C, as the young folks called them. I wanted to be part of their squad. We shared our values and were invested in this work as a way of enhancing opportunities for young people of color and as a means of addressing equity. We all felt the importance of placing young folks at the center, and because of this, our work was elevated and our relationships thrived. Early on, I asked them, how could I partner with you? As part of our commitments to one another, I asked, what was it that they needed from me and or our health system? And from that conversation arose a start and strengthening of a beautiful bond a partnership, of leaning on each other, on having each other's back, on showing up, on celebrating our successes, on growing from our failing forward experiences, and on amplifying our shine theory. Their ask, essentially clinical shadowing opportunities, to bring young people into a safe space in our clinics to learn about opportunity, about what is possible, what is imaginable, about seeing themselves in that space, and for acknowledging and owning the audacity to dream big and bold dreams. So from the beginning, I started this work on the sidelines by design and not at the center of the snowflake. As I've said before, I work on pipeline program development because I know they work. I do this because I want to make sure that Todd, a young Black man raised in Richmond who attends Berkeley City College and works 2 jobs at Home Depot and in our clinic as an advocate, learns about different careers and sees a possible future as a provider. After shadowing one of our family medicine residents, he was excited to share, "I shadowed a family doctor today. It opened my eyes to a whole new set of the medical field. I learned a lot." I work with our community partners, Public Health Solutions and RISE, to provide clinical shadowing opportunities for Deja, a Richmond native and young woman of color who attends De Anza High, so that she learns about behavioral health as a possible future career and the dire need to have young women of color provide trauma-informed care to our communities. She stated, "I was able to shadow a psychologist, and she told me that the field wants to see young women, and particularly a young woman of color, and she reassured me that there are opportunities for me." I work in collaboration with Jen Shrestha, Angela Rogers, Jen Estrada Melgar, and a group of residents of color who recently formed our residency program's first ever Resident Diversity Council. And I help to cultivate their leadership skills and anchor their commitment to young people across Contra Costa County. Because truth be told, I want the young folks who live in Richmond and have shadowed in our clinics, like Todd, Deja, JJ, and Consuelo, I want them to find their calling, their possible future, and to imagine themselves as health professionals occupying seats in this room to become the next visionaries and bold leaders of a future generation. To become the best versions of themselves and the future Christina Rosenthal, James Wong, Kai Kennedy, Amanda Brosnan, Jordan Luke, Sarah Hooper, and Salam Badada, the best visionaries of our time. Recently, I had the opportunity to hear Angela Davis speak. She is a fierce social justice warrior. I know I don't have to explain who she is, but a former political prisoner, activist, and academic who spoke about her lived experience as a voice of resistance. She spoke about a new revolution, one that will be led by feminist values, a revolution led by young people, one that will lean on imagination and creating anew, and a movement that will not be led by one leader, but instead by a leader-full revolution. In closing, I invite each and every one of you to talk to a young person, to share your journey, your dreams, and importantly, your struggles of feeling forward. I invite you to listen to a young person and learn their truth, their lived experience, and about their vision for the future. Will you join me in lifting up others as we climb? Will you be part of a revolution, one that puts young folks at the center and imagines a new possible future? I hope you will. Thank you.